So today we're going to talk about the HPI, which if you look at any note is also called, in the note it's called the subjective, and it runs from here down to here where it says objective. One way to think of the subjective is that this is a recording of the patient's perspective as recorded by the physician. I have an example here where the patient's a 32-year-old female patient who is feeling lightheaded. What we're going to learn to do is we're going to learn to kind of pick this apart for different elements that are necessary for billing and coding. I have a worksheet that may look familiar because we've used it before, but it was really rushed. So this time, instead of taking 3 minutes to go through it, we're going to take 3 weeks to go through it, and it should make a lot more sense. The history part of it is just this section right here. This is all that we're going to deal with for this week, is just the HPI. Now all the work to do that is down here. There's one section that's not here, and then that's the history, just because for the most part it doesn't really need a worksheet. It's pretty easy to take into account. Now the first part of HPI is what we call descriptors. When physicians nowadays go to school, they typically learn acronyms to kind of help them glean information from the patient. So one is colder as, which is condition, onset, location, duration, exacerbating factors, relieving factors, associated signs and symptoms, and severity. Another one is liquor AAA, which is location, intensity, quality, onset, radiation, associated signs and symptoms, aggravating factors, and alleviating factors. Billing uses one. I've made it into an acronym as well. It's LOST QCAM, LOSTQCAM. And I'm going to go through each one and then kind of show you how to pick those out in a note. First is location. And a location can be an anatomical site, or it can actually be something that is like a disease itself. So over here, a patient is a 32-year-old female, presents for initial lightheadedness is the location. That is part of the cardiovascular system, and so we know it's in the cardiovascular system, so therefore it is a location. Onset, duration. Onset and duration mean the same thing. The technical term for it is duration. I changed it to onset just to make it into an acronym. It's easier to remember. But they do mean the same thing medically, and it's how long a patient has had the disease. So over here, we've got this since yesterday. That is duration. Okay? It's giving us an idea of how long she's felt this way. Severity is, how bad is it? Now this can be typically one of three ways. Is we can see it as a pain scale that's used. We can see it as mild, moderate, or severe. Sometimes they'll use that indication, or it can be implied. So if somebody's got asthma and they're using an inhaler every 2 hours, that's an indication of how bad it is. Over here we've got has had to stay in bed and not do very much. That actually counts as severity. She's giving us an idea from the patient's perspective of, how bad is this condition. Timing is frequency. In this note, there's not really a good indication of severity or of timing that I've seen. At least not directly. There's an indirect one, but I really kind of want to stick with the ones that are definites here just for the sake of education and instruction. But timing would be like if somebody's got diarrhea. They may have had it for 2 weeks, but if they're having bowel movements 4 times a day, that's timing. It's frequency. Another thing that timing can be is it can be things that kind of make it worse. So if somebody stands up really fast for our lightheaded case, then that could be timing. Another thing that timing can be is there's certain keywords you can look for. Constant, persistent, on, off, all the time, things like that. And, those are kind of one-word little key phrases that give an indication of how frequently this is occurring. Quality will always be usually one-word adjectives. I don't have any in my example, but they could be words like red, watery, dark, clear, soft, hard, sharp, dull, achy, burning. Sometimes can also be a quality keyword. Typically they tend to be adjectives, and they tend to be a color or something that kind of qualifies what the patient is saying. Context you can think of in terms of two ways. It can be in terms of etiology, what are some of the underlying causes for this disease, or it can be compliance. So somebody's coming in for a follow-up problem, and the physician is not just saying they're on these meds, but they're taking these meds as prescribed. They're doing the exercise plan that we agreed to, or they're not doing it. That is compliance. Both of those two are the easiest way to look for context. Typically, if you feel like you're reading a story, you've stumbled across context. It's not very well defined, but I think those two pretty much cover most of it. So right here for our patient here, we've got started her period 3 days ago. That is context. We're looking at an underlying cause for the lightheadedness. And since both are related to cardiovascular function, that's kind of the direction the physician is going. Okay? Associated signs and symptoms I'm going to skip for now. We'll come back to it real briefly here. Modifying factors are anything that the physician, that the patient has tried, whether they're successful or not. This, if you get the chance to train physicians, this tends to throw physicians a little off, because to them modifying factors is anything that makes it worse or better, not anything that they've tried. So it's important for them to put that in there clinically, but I don't think, since they're aware of it, that they do it very often. So I don't think there's anything in here that really shows me modifying factors. So those are descriptors. Once you've gone through the note and you've looked for descriptors, then what you're going to do is they're going to fall into one of two categories. Remember that descriptors are right here under this column. And there's two possibilities. There's 0 to 3 descriptors, or 4 or more. And we'll go into 3C in a little bit. If you find 4 or more descriptors, once you get to 4, you can stop. Okay? The goal, quality-wise, should be in this upper bucket. That's the goal. You should always be in this upper bucket. If a physician is here, it's either a really limited problem or it's just poor documentation. So it's important for physicians to know that they need to communicate things to other physicians and to insurance companies by making sure that they do grab some of these descriptors. Just as a side note, descriptors are something that's probably only been taught in med school within, I would say, the last 10 or 15 years. I have some physicians who are older physicians who I talk to them about these acronyms, and they just give me a blank stare. They have no idea what I'm talking about. So it is something new, so if you tend to be educating physicians, you're going to want to keep that in mind, that older generation physicians are going to have, I think, a harder concept with this. A 3C note is basically if a patient presents with 3 or more chronic illnesses, you do not have to look for descriptors. They just have to list each disease, and then they have to give a statement from the patient's perspective as to the management of that disease. Now, from the patient's perspective means that the patient is the one who knows about it. So the classic example that I give is that if somebody has, say, diabetes, when they present, if you get blood sugars, that's from the patient's perspective. But if you get an A1C measurement, that's not from the patient's perspective. That is actually from the physician's perspective, because the patient would have no clue that that was actually going on unless they came into the clinic. So that's a brief description of descriptors to kind of go over it. For quality purposes, I like to see 3 or 4 per complaint, but for billing purposes, quality-wise, they should have at least 4. If they don't, 0 to 3 is still a valid selection, but they tend to be very skimpy notes. Next video, what I'll do is I'll go over review of systems and probably past medical, family, social history. This is all part of the HPI, but I need to divide it into smaller sections.